Something is silently killing your goats right now, and you won't see the signs until it's too late. What if I told you that 90% of goat farmers are collecting their samples wrong? Today, I'll show you the secret veterinary techniques to accurately diagnose diseases using simple tests you can do at home. No fancy equipment needed, just watch closely. Right now, hidden parasites could be feasting on your goat's blood while dangerous bacteria multiply in their gut, and you wouldn't see a single symptom yet. What most farmers mistake as simple weakness or bad appetite, I'm going to show you how professional veterinarians detect these silent killers weeks before visible signs appear, using simple tests you can perform with basic household items. 2. Critical sample collection protocol. Detailed explanation. The foundation of accurate diagnosis lies in perfect sample collection. Never make these 3 fatal mistakes. First, avoid surface contamination by discarding the top 1/4 inch of dung. Second, collect from multiple fresh piles to get a representative sample. Third, immediately place samples in clean, dry containers. Plastic bags cause moisture buildup that destroys evidence. For liquid diarrhea cases, use a clean syringe to draw samples directly from the rectum. Pro tip: morning samples contain the highest concentration of parasites as they're most active after overnight feeding. 3. Sample preservation science. In-depth knowledge. For blood samples, EDTA tubes prevent clotting by chelating calcium ions, while heparin tubes are better for biochemistry tests. Remember to fill tubes to exactly the marked line. 4. Advanced field diagnostics. Professional techniques. Transform your smartphone into a diagnostic tool with these tricks. Place a drop between 2 glass slides and shine your phone's flashlight underneath. Healthy fluid shows uniform swirling protozoa. Carry a glucometer to check for pregnancy toxemia. 5. Laboratory submission secrets. Expert-level advice. Maximize your lab results with these insider tips. When mailing samples, include a frozen ice pack wrapped in newspaper. This maintains 4 degrees Celsius for 48 hours without freezing. For trace mineral testing, collect samples in acid-washed containers to avoid metal contamination. 6th, interpretation and action plan. Decision-making framework. Learn to read reports like a vet. A fecal egg count over 500 EPG demands immediate deworming, while 200 to 500 requires retesting in 2 weeks. For blood tests, PCV below 24% indicates severe anemia needing iron supplementation. When you see these exact combinations, high BUN with normal creatinine indicates dehydration. For bloat cases, keep a 14-gauge needle and trocar handy. Immediately administer CD antitoxin. The first hour is crucial. If you implement just one thing from this video, make it the formalin preservation step. This alone will improve your diagnostic accuracy by 300%. Want my complete parasite identification flowchart? Comment GOAT Master below. I'll send it to the first 500 farmers. Share this with your local herding group. Someone's goats are dying right now from problems this video could solve. And stay tuned for part 2, where I'll reveal the forbidden injection techniques that corporate vets don't want you to know. Of course, reality hits when you're chasing goats with sample containers. Drop A in the comments if your goats specialize in sample rejection therapy.